A structured medication review, it's a conversation between a patient and their clinician to review the patient's medicines and make sure that it's still the best medicines for them. Patients that would be suitable for a structured medication review are those who require a bit more of an in-depth review of their medicines. Patients who take a larger number of medicines, patients who live in care homes, and patients that take medicines that are a bit more of a higher risk.
What we really want to find out is how the person feels about their medicines, what matters to the patient in terms of their health goals, how do they feel about their medicines, are there any medicines that they don't feel are working, are there any medicines that they feel are causing side effects.
A structured medication review would most commonly be done by a practice pharmacist working in a GP surgery. However, they can be done by the GPs themselves. It's that opportunity to then review the medicines clinically and check that they are still appropriate for that patient, but with the patient present and involved so that their input is also included in that decision making. A structured medication review would, as a minimum, be done on an annual basis. Sometimes it might be necessary to have that more frequently, so that might be that it's every 6 months in maybe a more high-risk patient or just someone that you feel requires that follow-up.
Before starting a structured medication review, a healthcare professional would generally look at the person's records, looking at their different conditions and also the list of medicines that's on the system. Before a structured medication review, patients receive some information explaining what it is, but also maybe giving them some questions to consider. It's about building a rapport with them to encourage the person to participate. I sometimes say to people that this review is not about saving money, it's not about taking away medicines that somebody doesn't want me to take away, and it's okay for them to tell me if they're not taking their medicine. I'm not going to tell them off. And then it's about asking open questions to try and get people to open up.
Structured medication reviews can be done over the phone, depending on the preference of the patients, but you can also have structured medication reviews done face-to-face where the patient comes into the practice, and sometimes patients will have their structured medication review even in a home visit. So one of the important things about structured medication review is making sure that you introduce yourself to the patient and explain to them what the purpose of that appointment is. Hi Fiona, my name's Hidiel. I'm one of the pharmacists at the practice. You're here today for a structured medication review appointment, is that right?
Yes, please. Yeah.
Good. So have you had one of these before?
I haven't, no.
I'll tell you a little bit about what we'll be doing in this appointment. So really, it's just an opportunity for us to have a chat about your medicines and make sure that everything that you're taking at the moment is still the best thing for you. Always make sure that you give the patient a chance to talk about their concerns first before bringing up any clinical concerns that you might have wanted to discuss. You mentioned that you did have a few questions for me today.
Yeah.
It's really important for me that we make sure that we prioritise those questions so that when you leave today, you know that you got the things that you wanted to know from me. We definitely answered those. Anything else, we can always address it at another appointment. Is that okay?
That'd be really good, thank you.
Remember, when it comes to making decisions during a structured medication review, to give the patient options. For example, explaining what the risks are, what the benefits are, if there are any alternatives, and what would happen if we just did nothing. So I think it's an opportunity now for us to think about what the options are. So what we'll do is we'll go through each of your medicines and we'll think about what the benefits of taking them are, if there are any risks of continuing with them, are there any other alternatives that we could be thinking of instead? And actually, what would happen if we did nothing? Make sure at the end of an SMR to always summarise. Right, Nazreen, we've come to the end of the review and we've had a really good discussion about all of your medicines and come to an agreement about which ones to carry on with and which ones to make some changes to. Would it be helpful if I jot all of this down in a text message for you, just as a summary, and then you can always refer back to it later before our next review?
Yes, that'll be really useful, thank you.
Safety netting is really important in a structured medication review. It just means making sure that anything that's been discussed, any decisions that have been made, the patient goes away with a little plan, knowing that they can come back with any concerns that they have.
During a structured medication review, we may come to a shared decision that we're going to try without medicine. So those are the words that I would use rather than stop. Stopping a medicine sounds really final, and trialling without reassures the person that you're actually going to trial it and that you're going to follow them up to see how they're getting on. After a structured medication review, if we're reducing a medicine, it's really important that you've made a follow-up appointment for them so that they've got a set point in time when they know that you're going to be in touch to see how they're getting on.
The admin team are involved in arranging the reviews but also supporting that follow-up and making sure the patient gets booked in with the right person. There are a few resources which can be used to help support a patient prepare for their structured medication review, such as the Reviewing Your Medicines invitation letter, which is sent out before the patient comes for their appointment, and the Me and My Medicines Charter to help the patient prepare for the fact that this is going to be a two-way conversation. Remember to reassure the patient at the end of a structured medication review to get in touch if they have any concerns.